So you're counseling, you specialize in couples, correct?
Mm-hmm.
So when you get a couple to come in, gay or straight, and they are really, really at a bad place and they're fighting a lot, how do you deal with that?
Yeah,
I wouldn't
how
even
does
know
that
where
work?
to start.
Well, the Gottman Method has the first 4 sessions are assessment.
Mm-hmm.
So I kind of watch them. This guy, John Gottman, for, 40 years, he's a psychologist. And psychologists are not necessarily talk therapists. They're researchers.
Mm.
And so for 40 years, he studied couples. And he didn't make any interventions. He just studied them. And he came up with some things that they do that if he looks at that, he can tell with a 96% accuracy rate if they're going to make it or if they don't.
No way.
Way.
96%?
Way.
It's amazing.
What?
So there's a thing called the 4 horsemen. These are the things he looks for. If a person is critical, always blaming. If a person is contentious, like, I'm so much better than you are.
Mm.
You're lucky to be with me.
Oh God.
But we know people like that.
All my exes are like
Yeah.
that.
And if you would, you're a real pain to me. Okay. And then followed by defensiveness. I didn't do that. You're the one that does that. Okay. And then the 4th one is called stonewalling, where I just don't talk to you. I don't look at you. I don't talk to you. I don't, But really what it is, it's not that I don't care. It's that I'm so overwhelmed with what's going on right now that I don't know what to say.
Mm-hmm.
So I'm just going to shut down. So those are the 4 horsemen. And so when you see a couple, if they're in that and that's all they're doing, they're not going to make it.
Not even with counseling.
With counseling, yes.
Oh, okay.
I got it. Okay.
So what happened is this guy, John Gottman, met this girl, Julie, and I don't know what her name is, but it's Gottman now. They married. And she said, you've got all this data, this wonderful data. Why don't we do something with it to help couples?
Mm-hmm.
So she brought in the intervention part, the talk therapy part.
Okay.
And so then we use this data from him. And so, like, if you start from a critical point of view, I talk to my clients about using I words instead of you. It's really hard to hear that you. So it's like, I was sad
Mm-hmm.
when you didn't know there's you. I was sad that I had made dinner and it just sat there cold.
Oh, wow.
Okay. So the person might go, oh, I should have called you. I should have,
I would never cook again.
So it's called, right, but it's called a soft startup. Instead of starting here,
Right.
where do you go from here?
Right.
But starting here. So his studies showed that if you started from a soft or a non-harsh startup, the first 3 minutes of communication will show you what the rest will be. If it's a non-harsh startup, it will be that all the way through. If it starts here, it'll be there all the way through.
Mm.
So that's good information
Very good.
for people to have. If you think you're so much better than the other person, then I think you need to think about all the good things that person has
Yeah.
and offers to you, and build up your appreciation of that person, and
Right.
speak to that person with respect.
Yeah. Because it's so easy to just see the bad.
Isn't it?
Yeah.
If you could weigh a negative and a positive, I will
Mhm.
tell you a negative would weigh more.
Yes.
Yeah,
it
for
just
sure.
does. And I give you a test that has 10 questions, and you make a 90. Pretty good.
Yeah.
I give you the test back. What's the first thing you do?
I look at the one that I didn't make. It's it translates to, we go back a lot because this was a big event in our life with the dance studio. We had the dance moms are a big issue always, and we talk about it a lot. And 20% of them were absolutely horrible, and 80% were great. But those 20%, they ruined everything. Basically, I mean,
Well,
really,
and all your energy went toward that.
yes,
you know?
and that's what that makes sense.
Yeah.
Yeah.
So we have to remind ourselves, everyone listening, if you're in a relationship or if you're married, look at all the great things
That person is.
Yeah.
that person is and has
brings
done
to your life.
brings to your
Yes.
life. Now, of course, always taken that they're not abusive.
Yes.
Yes,
That's never a
that's
good thing.
totally different.
Yes.
Mm-hmm.
So if you're defensive, the best thing to do is to take responsibility.
Mm-hmm.
You're right. I left the spoon in the sink again. You're right. Now that may sound silly, but it's not, is it?
Because someone that's a big deal.
You bet. I'm one of them.
Well, maybe because you've asked over and over.
Well,
and
the dishwasher's right there.
Yeah. I get it. Yeah.
Or something like that. The thing is, you take responsibility. That's right. And then the last one, the stonewalling, is that you need to find a way to calm yourself down. You need to find a way to lower your heartbeat. And one way to do it is when people have watches, you all may have this, it has your heartbeat on it.
I need that.
And you try to, or there's a thing I call a pulse oximeter that I give my clients, and they can look at it and they can get their heartbeat down. But it takes about 10 minutes. But a lot of people you can't tell. Like some people you get it when they're all worked up. They got that vein sticking out, they're all worked up. But some people are quiet and you don't see it. But it's like that duck on the water, and their feet are just going underneath,
I think that's me with anxiety.
Yeah.
You would have no idea, but I'm inside. I'm like having a panic attack very quietly, not to affect anyone else's day.
Right. And that it's hard to see.
Yeah.
Know? But what happens is perhaps that you stop talking.
Mm-hmm. Yeah, I do.
And then that's what we would call stonewalling, but that's not a negative thing. That's I'm an overwhelmed thing right now. And sometimes you don't know that.
Right.
Because it's you,
Yeah.
Mm-hmm.
But anyway, so that's what I do with couples. And then I help them find common ground in conflicts. They'll both tell their point of view, both valid.
Separately or together?
Together.
Mm-hmm.
Just as valid as it can be. I saw this, I interpreted it this way. I saw this and interpreted it this way. I mean, both very valid. And so behind every conflict it is really kind of a cry for something. Attention.
Mm-hmm.
Loving, something. And so instead of saying you say things like, I'm lonely.
Mm-hmm.
I'm in this marriage with you and I'm lonely. And I don't want it to be like that. I want it to be close like we were before, that
Right.
kind of thing. And then try to find some kind of compromise. Can we live with this?
Right.
And how do we live with this? So, yeah, I can help people.
What about cheating?
With if it's a closed relationship,
Mm-hmm.
right?
Mm-hmm.
And everybody knows what that means. That means whatever that means. It may mean something different to me than it does to you.
Mm-hmm.
I hear a good amount of folks say, I'm in a committed, relationship. It's don't ask, don't tell.
Oh, like if you're like with someone, I don't ask them if they've cheated on me.
Right, and I don't tell. But because, you're mine and I'm yours.
Dang.
That happens?
Oh, yeah. And it's a deal.
He looks so shocked right now.
I am blown away.
because she is. Yeah.
And but it's supposedly and agreed upon with the two. For me, a closed relationship is a closed relationship.
Mm-hmm.
But those are my values,
Right.
right?
Mhm.
And those are my morals. You get to have yours,
Right.
and it doesn't have to be mine.
Mm-hmm.
But it does have to be y'all's,
Right.
So that will never work if one is not in agreement with that.
Yeah.
I think it's hard to. I have a lot of supervisees who study under me to get their license, and one guy presented a couple today that the husband wanted an open relationship, and she didn't. The wife didn't.
How long were they together?
I think 11 years, a good amount of time, and so I talked to the supervisee about what he could do, and I said, when it comes down to the compromise, For the life of me, I can't figure out what it would be, but maybe they can figure out something. I don't know. If they can find common ground, because it's their relationship, not ours, not his, the supervising, and not mine, then, whatever. But I would think that would be kind of a deal of, we just can't find the compromise.
Right.
And so let's start looking at what splitting up would look like. Splitting up is never wonk like that. It is always like this. It's a process.
Mm-hmm.
So maybe we start with somebody moving into an extra room, if there's an extra room. Let's not just go divorce. Let's, kind of go through the process.
I thought you were going to ask me.
No, I'm taking that
She's
in.
processing.
Yeah, she's processing.
No joke.
I can see that.
Mind is working 1,000 miles an hour over there.
Now I do, as we're talking about this, I do know someone though that closes her eyes to everything he does because he has a lot of money. And so he gets to do whatever he wants basically, and he gets to enjoy the prostitutes and the strippers and the other women, and she doesn't say anything.
She doesn't care, obviously.
And as a therapist, not as his wife, I would not think this at all as his wife, as a therapist, I would think he's medicating.
Oh,
What's up
wow.
with him? I mean, that cannot be fun. Think about it.
No.
It really can't be fun.
Mm-mm.
I mean, having one spouse is kind of a lot. Having a lot of them to please a lot of them,
Mhm.
and prostitutes.
Mm-hmm.
Mhm.
There's not going to be any love there, really, or is there? But he's medicating.
Mm-hmm. Like a sex addiction-ish, right?
Yes, sex addiction, exactly, or love addiction.
Mm-hmm.
Because sometimes they do fall in love with all these people,
Mhm.
So I mean, that's it. If I was his wife, I would feel as you do. That that's not fair and that's not right. And he's going to bring home all kinds of germs. I would hate that.
Mhm.
But there's something up with him.
Yeah.
That's what I would say. Because he doesn't leave her.
No, that's
He
so
takes
crazy.
care of her financially.
Yes. Mm-hmm.
So in my opinion, he loves her. What's wrong with him? What's up with him?
That he
Yeah.
needs all that other stuff.
Yeah, and you'd think does he need women? And I think my premise is he needs to not feel
Mm-hmm.
Wow, that's interesting.
the rush.
Mhm.
Oh, that's what feels good.
Well, and I think the money came, and so now it's like I can do anything kind of thing. Makes him feel better about himself, I guess.
for a little, and then he feels horrible.
Mhm.
True.
Because I bet you his values are not that, everyone should cheat on their wives.
No, I don't think.
I think
they're-
he probably has good values and
Mhm.
morals. He's out of control. Something's up
Mhm.
with him.
That's
Mhm.
interesting.
Very interesting. Can you tell us, and of course no names obviously, but tell us like your most successful, like what do you think some of your most successful cases that you have counseled, and some of the most that like broke your heart because you just had your heart in it and wanted to fix them and just couldn't.
The thing that comes up for me on the second one is that when I was 20, there was a state hospital in my little town. And in the summers, I would work at the state hospital. And state hospital is a mental health institution. Poor. You go there if you don't have money. And there was a guy, I used to teach, thank God I had the answers, the GED class, the high school equivalency degree.
Uh-huh.
And it's hard.
Mm-hmm.
So glad I had
That's
the
what I
answers.
heard. Yeah.
I mean, I think it's harder than high school. At any rate, so I had this guy in my class, and he was, I guess, about 40, and he was a truck driver, and he was alcoholic. I did the alcoholic and drug addict unit. And so we studied and studied and studied this, and he was ready to take his GED. And I told him, I said, it's not a time test. You go down to the community college, and you can take as long as you want, So the woman who gave it to him, he said my name, and she knew my family, and said, Candy, we'd never had anyone take as long as he did to take that test. But he took it and he passed. And I was so glad. I was so happy for him. And so he left the hospital, but a month later he came back. And so that was real disappointing to
Mhm.
me. And so I learned a lot from that people have relapses,
Mm-hmm.
And that's part of recovery.
Mm-hmm.
That doesn't mean that all is lost,
Right.
Anyway, so that came to mind when you said that. Successful, there's nothing that really stands out in my mind, like, he walks again, or he gets but I think what is successful for me is that when I get emails or letters from people thanking me for helping them, 20 years ago or something, or even
That's
5
really
years
cool.
ago.
Yeah.
Oh, gosh, I'm telling you. It's a great feeling.
Yeah, I'm sure.
Yeah.
Do you deal with parents who bring in their children that are addicted to drugs?
I refer normally. I might help the parents see that there is this problem. But there are agencies, and there are, inpatient settings where they're more adept at dealing with that kind of thing.
Mm-hmm.
But as a marriage and family therapist, there's a theory that goes with being a marriage and family therapist, and the theory is that people work in systems. That people do not live alone. In other words, if there was a problem in your family, and I took the identified patient out and worked on them and put them back in, and that system was still sick,
Yeah.
We
So-
just heard about that.
Did you?
Wow.
So I like for the
Yes.
system to come in. And then if the kid, is acting out in school, truancy or drugs or whatever, I will say to that kid, thank you for bringing in your family. And they'll all just kind of, but the kid doesn't. On some level, the kid knows,
Right.
but
there's something.
my family needs help.
Mm-hmm.
So that's, the children will act out the pain of the family.
It's really interesting, actually.
Wow.
Yeah.
Yes. So it's the being a marriage and family therapist is a whole theoretical point of view.
Wow. For some reason, I've had, I don't know why, so many people close to me that have been affected with alcoholism, and it's really difficult, to know what to do. Is there something that you the relapses all the time, and then what happens? The more that happens, then they remove themselves.
They being the
From-
alcoholic or
Mhm.
or
The alcoholic,
Okay.
removing themselves, because now they know that I know, and even though I don't judge, I just want to help, but still they remove themselves all the time, and there's more relapse all the time again, and it's a big issue.
For her, yeah.
And I don't know why, but do you deal with that at all too?
Yeah.
You want just advice on how to
Kinda.
deal with it?
Okay, good. So there's a whole theory around addiction and around families. And there, you've heard of 12-step programs. So let's say that your loved one, whoever that is, they're in their addiction. And when you're in your addiction, nobody is more important than that next fix, whatever that is, gambling or drinking or whatever. No one is more important. You're not. It is that drug or whatever I'm going after. So, you don't have a lot of, I don't think, influence on that. But what you can do for you is to go to an Al-Anon meeting. You've heard of Al-Anon? Yeah. Okay. Because I love Al-Anon because it's for people who have a loved one in their family that is an addict. And they may or may not be in their addiction at the time. It doesn't really matter. But you go. And they say to you, do not make any changes for a year. So they support you in staying in there. They're not going to tell you to leave or tell them to leave, however it goes. And I really like that. There's also a program called Adult Children of Alcoholics.
Mm-hmm.
That's another.
I actually have a book.
Yeah, that's another 12-step program. It's just kind of neat to go and hear people say, yeah, I'm scared for my child too, or, my spouse is doing the same thing. He can't keep a job. Whatever it is, it's just there's some camaraderie in there. And then maybe after that time, the year's time or whatever, then maybe you're ready to make some decisions. This person is going to do what they do, regardless of what you do.
You say that.
I tell you that every
She does tell me all the time.
She gets so emotional. She gets so upset, but I don't think
It's upsetting.
I know it is.
They're circling the drain,
Mm-hmm.
and they're not putting a hand out. They're just not. That's just where they are, and it's just sad.
It's hard to watch.
Yes, and that's why I don't want you to watch. I would like for you to go to that meeting and talk about yourself.
She's been told to go a lot, you said. Or
Yeah.
and then she doesn't.
And here I'm telling her too.
I know
Yeah.
it.
I wish I had something new to tell you.
She was probably wanting
I mean,
different.
in this particular case, it's one of my very best friends, and the last conversation we had was basically she was doing the 12 steps, and she called me and she said, I'm coming to you soon because I have to come to you and apologize. And I said, well, you never have to apologize to me. And she said, no, it's part of my steps.
Just to make amends. Yeah.
And I said, well, if you have to do it for yourself and to get better, of course, but I love you regardless. Well, that's the last time I heard from her, which was in March. And I've heard that she has relapsed since. So obviously that didn't happen. So now I'm like,
But your dad was an alcoholic.
Yes.
Her best friend passed away from alcoholism. Your best friend now is one. And I think she just gets
it's so many and you can't do anything.
and a few more.
Yeah.
And so I think she just gets so upset and she wants to save everyone.
Well, from a, kind of a spiritual point of view, I believe this is that the universe continues to put that lesson in front of you until you get it.
What am I supposed to get?
We'll have to see.
Oh.
But I mean, that's why the lesson keeps coming to you.
Crazy.
Maybe you need to go to that thing.
Oh, maybe I need to go.
Maybe
That's
so.
what I have to do.
Change the light
That's
bulb.
my lesson. Now,
Well-
Candy, you are big in the LGBTQ community, correct? Tell me what you do.
Well, I don't do as much now as I used to do, but in the past, I was real involved with the Human Rights Campaign, which is the largest lobbyist in D.C. for LGBTQ issues. And we do it through politics, through getting like-minded people elected and making sure non-like-minded people lose.
Mm-hmm.
And I chaired that organization for 4 years, and I was involved for 10 or 11 years there. So it was really wonderful. What I do now, the LGBTQ thing I do now is there's a gay chamber. Who knew? But there's a gay chamber of commerce. You should have somebody on from there.
Is it LGBT chamber?
It's called, well, they do it the wrong way. They call it GLBT.
Oh, yeah. And I know about this because my best friend Tommy, who actually joined
The chamber?
joined the chamber a few months ago, told me all about it.
Now I have to get someone on.
Yeah.
Mhm.
Yeah.
Yeah,
Mhm.
I think that'd be good.
We need him on again anyway.
Yeah,
We
we
do
do.
need
That'd be a
Tommy
good
on.
excuse to get him up here.
Yeah.
Yeah. Well, tell him to bring somebody. Tell him to bring
Mhm.
Tony.
Tony.
Tony is the president. Tony Vedda,
Okay.
Vedda. And I served on their foundation board, which is a 501c3 board. You can give money and write it off.
Mm-hmm.
We give scholarships, academic scholarships to GLBTA. There's an A in there. You know what that stands for?
No.
Allies.
What's that?
Oh, friends.
Friends.
Oh.
They're not gay or lesbian, but they're
Just
allies.
friends.
Yeah.
Mhm.
And that's what you all would be.
Mm-hmm. Oh, that's cool.
Yeah. But anyway, so the idea is to give out scholarships to these folks, and then when they're through with their education, hopefully they will come back to the Dallas area, and they will give up their time
Mm-hmm.
and talents too. So it's one of those.
Helping each other.
Yeah. Uh-huh. But that's about all I do right now. I'm a GLBTQ counselor. I have a lot of straight clients too. I mean, because people are people.
Yeah.
Yeah, right.
You know?
Right.
Same kind of issues.
Right.
This might be a stupid question. What is the Q?
Nothing stupid.
That's not a stupid
Okay.
question. So LGBTQ, sometimes there's another Q, and sometimes there's a dash and an I. Okay. Lesbian,
Mhm.
bisexual, gay, transgender.
Mm-hmm.
Q for questioning or Q for queer. That's why sometimes there's two Qs. I just put one.
Okay.
But sometimes people are questioning what they are. And sometimes people want to take back that word queer and own it.
Okay.
you know. And then I for intersect. Intersex.
What is that?
That is when you're looking kind of at your gender and are not taking one role or the other. You're not self-identifying as gender male or gender female. You're just gender.
Okay.
And that is coming up more and more these days.
I think it is. I always feel like I'm such the wrong person to talk to you about that because I'm older and these are all kind of young folk.
But
you're age
she is
folks.
young, and we talk about this, and
Yeah.
we actually, and we have a strong opinion about it, and we,
Well, I get confused when people say they're going to raise their children with no gender, because I feel like regardless what you identify with, you're still a male or female by blood, whatever that may be.
Birth.
And that's fine if you want to be a woman. If you're a man and you want to be a woman, I'll call that person a she if they prefer. But I don't know how you could say that there's no gender, because how would we like reproduce, and how can you, like, if you don't, I don't know. That's just.
no, but you are born as a boy or a girl.
Well, you have an
that's
XY chromosome or
That's
Right.
what
you
we
know,
that's what we said.
XX.
That's the only thing that confused me in the raising, because what were they calling them? They babies.
Babies.
They babies. I saw that on, like, now they'll give birth to a baby, not a boy or girl.
Because the pronouns they're using are they, them, their.
Okay.
Y'all's making a big comeback too because there's no gender to that.
Y'all.
Y'all?
Mhm.
Or yous guys? Or I guess those guys.
Yeah.
Never mind, I'm just kidding.
Y'all is such a great word.
It is. I
I
went,
love that word.
I went
Isn't
for
you
so
all
long.
some major Texan thing?
Yeah, and I
very
went so
Southern.
long like I wouldn't use it at all, but then
It's
like
so
someone told me that and I was like, yeah.
It is so efficient.
You all.
I love that. Not you all. Y'all.
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 I don't think you've ever said that word, really. I don't think they say that much in Austria. Y'all.
No. That is so crazy. Now, in your marriage, do you have roles? Like, does one have more the feminine role? Yes.
No, but people, some people do. No, we don't.
You don't.
We have a lot of trouble. If we were to dance, we don't know who leads, so we kind of dance in a circle. Honest to God. Yeah. We really don't. Some people do. Some people, they like that. They, this is how I feel in my heart that I want to lead. And they feel in their heart that I want to be led. So,
Whatever you prefer.
I think so. I mean, it's interesting. I have a group of girlfriends, and I, do a lot of counseling, so I see a lot of people. And it's interesting to see how they manage that. Like this is just traditional. The man takes out the trash. Is that not just traditional? And the woman maybe does inside the house, and the man does outside the house. But that's not done that way anymore in straight marriages.
Mhm.
Yeah. No, I know. I have friends who the girl does mows the lawn, and
The guy does the inside.
yeah, he cooks stuff like that.
I want to see you mowing lawns.
I've
You
never
should
mowed
see-
a lawn.
My friend, you would never believe she does that, Julie.
She likes it probably.
She loves
Some people
it.
like it to
Mhm.
work out.
Mm-hmm.
It's a workout, and they feel good about it. I
Mhm.
think the grass smells good. I never mowed the lawn. So
I'm not mowing
but I
lawns.
do think people play roles. So I don't want to say they don't, but
Mhm.
for me personally, we don't do that.
You don't?
Uh-uh.
So do you guys do date nights?
Do we have date night?
Yeah.
Yes, we're pretty romantic old folks. We not only, like we really do like hanging out. That the Gottman Method really makes me feel good about my relationship and makes me think I never should have questioned marrying her.
That's a good thing.
But the foundation of this, what's called a safe relationship house, is the friendship.
Mm-hmm.
And I tell people that is the best part of a relationship, is that companionship.
Mhm.
I agree.
The best.
Right.
I've always told my exes, they're exes for a reason, but I'm like, I don't understand how you could hurt your best friend, because I would never hurt my best friend.
Right.
And every time I've said it, they look at me like with these big eyes, because they don't think they thought about it that way.
They didn't think of you as a friend.
Mm-hmm. And I'm like,
but they
that's
would never
nice.
want to hurt Mark.
Right. Well, you never talk to your best friend this way. Exactly. And that's how I see it. I feel like the friendship is the number one.
Oh, it's the foundation.
Mhm.
It's the absolute foundation. So that means that you need to be able to communicate
Mhm.
with each other. But I will tell you that we have couple date night, which once a month we go out with our best friends.
That's good.
It's fun.
Fun. Yeah.
It's a lot of fun.
Good.
So it is about keeping the romance in your relationship, whatever that is. And I think date night's a good thing, in particular when you have children, because when you get together, it's about, Johnny needs to go here and Susie needs to go here and this bill hasn't been paid and did you mow the lawn and, that's not fun.
Now, do you see that a big problem in when you counsel people is money?
I think second highest reason for divorce, finance.
What's the first? Cheating.
Sex.
Oh, not having it?
Or having, or someone wants it too much, or
Really?
someone's having it with a neighbor, or
Oh, that's interesting.
if I were to write a book about relationships, I would name it Romance and Finance.
Really?
I think that covers it all, just about.
You're
I
right.
love that. You need to do that.
I need to write that
You
book
need to do
down.
that because I'll read it. Do you believe in the love language thing?
I do.
Me too.
I do believe in that. And I ask couples, there's that book,
Mm-hmm.
to read a chapter to each other.
Mm-hmm.
And if you want to, you can put your head in your partner's lap. Partner can read it, and then the next night maybe the other way around, and you read the chapter.
Mm-hmm.
I think it's a wonderful thing, and I think it's wonderful to talk about it with your kiddos too.
Oh, yeah, they have it for kids.
Yeah,
Yeah, I
yeah,
just
it's
saw
good
that.
stuff.
Yeah.
I think anything is good. You want to go to some kind of couple retreat or something like that, go for it.
Yeah.
There's something about focusing on your relationship that really helps it.
Well, because there was something good when it started, so somewhere
Yeah.
you just got
Yeah,
lost.
you wouldn't be in it otherwise.
Yeah.
I believe that you may not believe in this. I believe that people choose correctly. I think it's living together that's so difficult.
Ugh, I didn't choose right.
You see,
And I didn't live with. I only lived with 2 of them.
you see, I was quiet for a moment.
But maybe it's that universe giving you a lesson thing.
Right.
Oh yeah, no, it's so much. We've said since I was little, I have to learn everything the hard way. Like I have to beat my head against the wall a few times before I learn. So that's what I'm doing, just learning.
You
I'm just
got
doing the normal
you
thing I
got
do.
To the result you wanted, though.
Yes,
now.
I did. Yes, I'm dating a very sweet boy now. He's the first sweet one ever. So that's nice.
Do you like him?
Yes.
Oh, good.
Yeah.
Yeah,
That's
this
good.
one is a good one.
I do too.
Yeah.
Yeah.
He's awesome.
Yeah.
Okay.
Yeah. So that's good.
Hope.
Yeah. There's hope in that. Yeah. But the path, yeah.
Good for you. You can learn. You learn more from your mistakes.
Right.
I learned a lot.
Yeah.
A lot.
Over and over.
Yeah.
That's your mother.
I know it. She was gonna just try to start picking for me, and I was like, no, no, ma'am,
I was like, you don't know what you're doing. Let me pick.
no.
Oh my goodness. Miss Candy, please tell us of something that we don't know about you and that's important for you to share with our
You haven't
listeners.
yet.
Yeah.
Gee, what have I not told you? Well, I think I'm funny.
You
Very
are
Me
funny.
too.
Well, then you knew that. Okay.
Well, you're really cute because you're like one of those really like unsuspecting funny. It's really awesome.
And I use a lot of humor. My
Mhm.
family was funny. We're all
Mhm.
funny. So pretty much what you see is what you get. I mean, this is pretty much who I am. So I don't know what you have not seen.
No, I love it. And I want to tell everyone again that marriage, family,
Addiction issues,
addiction,
individuals, and supervision. I do a lot of supervision for people who are wanting to be fully licensed. They get a temporary license, then you have to study for about 2 years under somebody. And I like doing that. It's teaching.
Mhm.
teaching.
And I like that, as you can tell.
Yeah.
Yes, no, that's awesome. I love it. I think that when you're a counselor and what you do, what you said, that it means everything when you get those letters that you help
yes.
people. I think that's amazing.
I mean,
too.
doesn't it feel good though? I mean, y'all help
Mhm.
people.
Mm-hmm.
We try.
And
we
you
try
need,
to
and you
teach-
need to stop helping people so
Yeah,
much.
she does. I know. Sometimes I'm like, I need my mom too. Hello. She gets so, it messes with her anxiety and herself when she gets so involved to help. So yeah.
Sometimes I give up because I see like sometimes it's too late. Then you can't help anymore. So I don't ever want to miss out on something. Helping,
Well, you know, so you're not going to feel guilty that you've
Yeah.
turned over every
Mhm.
stone, and
Right.
then what you can do, and you're probably helping people more than
Yeah.
you realize.
She is.
You
Yeah.
just may not be able to see it,
Mhm.
but it's in their work. Whatever you're telling them, it's in their working. I was gonna say another thing for people with addiction. I don't know exactly how to do this, but there are things called interventions.
Yeah.
And I think you can get someone through AA
Mhm.
to help. You
Mhm.
know, have people kind of sit around their
Right.
person and tell them what they're drinking or whatever drug using has done to them.
I did that once.
Yeah, did it work?
No.
My dad never spoke to me again, ever, for 20 years.
So she won't do that anymore.
I will
She's
never do it
scared.
again.
Okay, so don't anyone listen to that. Take that away.
I think it helps for some.
No, I think it's helped
She just
a
had a
lot
bad
of people.
experience.
I mean, just in my case, it didn't
Well,
work.
he
but-
just wanted to use,
Yeah.
right,
you know, and
right.
he didn't want to take responsibility.
No.
So,
absolutely not. That's
well, shame on him because you were
know.
just trying to help him.
but so and then with my other friend, the same. It wasn't really an intervention, but same. So it's hard. It's hard. I think it's hard on everyone when someone is addicted. That's just
It impacts a whole system.
a whole
They
system.
do not live by themselves.
Exactly.
You know, people live within a system. Yeah.
Right.
It's a very abusive thing to do to folks, but these people are lost,
Mm-hmm.
you know.
Right. And they have whatever their reasons is what they
Right,
do
they
it
haven't
for.
hit bottom yet. Yeah.
Wow. Then sometimes you think, really? More bottom? Like you see people at
Some people die. I mean, some people go through the whole thing
yeah.
and never hit
Never,
bottom.
yeah.
But some people do.
Mm-hmm.
So
Wow. Miss Candy, we have enjoyed you.
I know. I
thank you,
learned so
ladies.
much.
Could you please give us your social media handles so for everyone to find you?
wonder what that means.
Okay, so
Candy Marcum Counseling on Facebook and on Instagram. I'm on Instagram.
yes.
It's the Candy Marcum. I didn't come up with these names.
This is your wonderful PR company that does all that.
It's like one you know.
that we
And-
love.
Yes. And I have a website called, interestingly enough, candymarcum.com.
Very
That's
good.
easy. That when everything's the same.
Yes.
It's good.
Mhm.
Easy.
Mm-hmm.
That's awesome. Everyone needs the services. Miss Candy is
Yeah,
ready
give me
to
a
help
call.
you. She's wonderful. She
And y'all
helped
are great
me.
interviewers. Y'all are really
Thank
good.
you.
Yeah.
Thank you very much.
It's really her. She does all the extra
Thank
work.
you. I
Yeah, but
really
look,
appreciate it.
she wasn't reading anything.
She wasn't.
No.
No.
Very good.
Thank you.
Thank you
when
so
I
much.
when I found out about you, I was so excited that you're coming on, and I was like, I can't wait to learn from her and hear your story, which
Yeah.
is really interesting. And I just think it's for so many people today's world when they need to just come out. I feel like. And just deal with it, and if people don't accept them, they'll come around, like you said.
Right, but it's coming out is nothing short of an act of courage,
Right.
because what you're putting up there is rejection
Mm-hmm.
Yeah.
of your family, the people who
Mhm.
should really love you. So it really is courageous to do, but it's too hard to live a lie. So
You have
Oh,
one life,
Yeah.
one.
that's
So
right,
You need to live it the way that you want to live it.
authentically.
Authentically. I like that one.
Yeah.
Thank you
Thank
again
you
for
so
giving us
much.
your time and
Yeah.
coming on. We really appreciate it. And have a wonderful day, everyone.